Hello, good morning, everybody. My name is Vera James, and I'll be moderating today's show. Today, Dr. Boyede is here with us as usual. She'll be taking us through a very lovely, interesting, and timely title, which is HIV and AIDS in children. We understand that December 1st is a marked for HIV and AIDS Day. So, as the pediatricians today, I've decided to take up this topic to share with our viewers. So, Dr. Bede will be talking to us on this. I'm glad to have all of you around. Well, I'll call her in soon, but I would like you to share the videos. You're welcome. I can see some viewers already. Okay, so please share the video, invite your friends. And it's usually better for a topic like this to start with as much as we can start with. So please invite your friends, share the video on your wall, share the video on your own personal page and some other groups that allow this. You'll be happy to do that with us, and you will enjoy yourself today with us. Hi, Dr. Boyede, can you hear me?
Yeah, good morning, Vera. Good morning, everyone. It's a pleasure to be here this morning. We're so grateful to have you join us this morning. I am Dr. Gwimisala Boyede, and on behalf of AXA Paediatricians Foundation, the organization that has brought you this program, I want to wish you guys compliments of the season and thank you so much for joining us this morning. I can see two of our last week winners already in the house. Yes, I guess they are going to win something. But today's program is brought to you solely by AXA Paediatricians Foundation. And just also let everybody watching know that if you want to be part of this program, if you want to be one of our sponsors, you can reach out to us and we would like to, feature your program or your products or your service on our program. So thank you so much, everyone, for joining us. Okay, so we're ready to start.
Okay, Dr. Boyede, thank you. Thank you for a very lovely introduction. And on behalf of the viewers now, and on behalf of myself as the moderator of today's show, I want to say thank you, Dr. Boyede, for being consistent, for everything you do to help the Nigerian child. We really appreciate you, and we trust that today is going to be a very lovely time with you too, because this is a very important topic you have chosen to discuss with us today. So,
Yeah.
Dr. Boyede, without wasting so much time, I think we should just go straight into today's business. So tell us, what is HIV and AIDS in children? Why did you, first of all, tell us why you decided to take this topic today? I understand, yes, I already said that it was World AIDS Day and all of that. But I mean, is there anything that is unsettling you right now? Because I know that sometimes you get unsettled and you just want to speak about something. So tell us why you're doing this today.
Okay, thank you so much, Vera. And just like you rightly said, last Saturday it was the World AIDS Day, and it's the day set aside for us to remember about people living with HIV/AIDS and how we can support them, how we can protect them. And UNICEF is starting a campaign where they are trying to see how we can reduce HIV/AIDS, especially in children, to zero. And so that's why we would have done this last week, but we already have a scheduled program. So today we decided to talk about it. And today I'll be talking about what HIV is, what are the myths surrounding it, especially as it relates to children, and how can we protect children? How can we join this UNICEF campaign to make sure that we reduce HIV/AIDS in children to zero? In 2023 they won. So anyway, but that's when 2030. So that's where the world is working towards, and that's what we'll be talking about today. So if you have questions about HIV/AIDS in children, you can drop it for us in comments, and then we'll be able to answer them. And I want to employ some of our viewers who are watching on the watch party. If you have questions, if you are very tech savvy, you can navigate your way to the real video and drop your question. That'll be absolutely good. But if it is not possible, I will employ our moderators who are watching with us. So please help us drop question. Last week, I saw many people were saying they wouldn't answer the question because the question was dropped on the group watch party, which we don't have access to when we are live, and we were not able to see them because we can't stream those kind of questions, but we can stream the ones dropped directly under the video. So our moderators will appreciate you if you can help us pull in any question drop under this video on any platform and put it under the live video itself so that we can feature it and we can answer it. Thank you so much. So without much ado, let's go into let me first start with the myths. Number one, some people even wonder whether children can have HIV AIDS.
True.
Yeah, okay. So number one, children too can have HIV AIDS. And for us in Nigeria, I mean, where we have a large population of children, a significant number of our children, of people living with HIV AIDS in Nigeria were our children. I remember when I was doing research in 2014, 2015, we realized that maybe about then, I think in Nigeria we have about almost 38 million, close to 40 million people living with HIV/AIDS. And out of these, 2 million or so are children. So pediatric HIV/AIDS is also quite common. So children have HIV because people think, oh, because when we mention HIV, people always think, oh, it's people that are doing
Through sexual
sexual. Exactly. And most times children are not sexually active yet. So, but I want to dismantle that mindset. So children do have HIV/AIDS. Okay. And you will now know why I really need to talk about children having HIV/AIDS with you, my viewers, who are members of active pediatricians or those who are watching us, who are parents, because 90% or almost 95% of HIV/AIDS in children comes from the mothers, from what we call mother-to-child transmission of HIV/AIDS. And that is why, even though we're talking for us in active pediatricians about HIV/AIDS in children, the people that really need to talk to are the mothers, because 95% of HIV/AIDS in children comes to the children through their mothers. How do they come through? So if a mother who is HIV positive or who become HIV infected during a pregnancy, she can transmit it to the child during pregnancy. She can transmit it to the child during delivery. She can transmit it to the child also through breast milk. So these are the three major ways by which mother-to-child transmission of HIV/AIDS occur. And apart from this mother-to-child transmission, even though it's about 90 to 95% of the causes of HIV/AIDS in children, there are other causes. So blood transfusion, remember, sometimes some children are very sick and we need to give them blood, and that's why we have to really make sure our blood is well screened. And that's why it's very risky to take blood in any quack or any, even city places that look like they are not proper hospital. Giving blood to people is very dangerous, and some people do all sorts of funny things. You know, you are exposing children to blood of other people that you don't know their status. So these are the ways by which children can get HIV infection. Also from objects, like some places where they see do scarifications, where they put marks on children, or when they do circumcision father for the boys or girls and they don't do it properly using the right instrument, through using babbing instrument and things like that. Any instrument where there can be a nick, there could be a bloodlet. And if that child, the child is exposed to that blood through his own blood as well being exposed. So these are the ways by which children can get HIV/AIDS. And let me quickly, while I'm still on that way of which children can get HIV, because I get a lot of loads of questions on HIV in active pediatricians. People ask, oh, my neighbor has HIV/AIDS, so can she carry my child? And she check my child, or she carry my child safe and all that. Okay, so while we're on that, let's just say that people don't get HIV/AIDS from hugging. Children are not going to get HIV/AIDS even from kissing. They are not going to get HIV/AIDS even from what other things people do with each other, from sharing toothbrushes. As long as the person doesn't have like dental caries or things that maybe the person is bleeding through the mouth, or from using your towel, or from eating in the same plates. People think that if I eat food with somebody who has HIV/AIDS, then I may likely have HIV/AIDS. So those are the various ways by which people can get HIV. But people don't. I mean, these are various ways people think that they may get HIV/AIDS, but people really don't get HIV/AIDS through that route. So it's very, very important for us to know that, so that we don't start wondering about that. Okay, so while we are still on that, I can see people are not asking questions yet because I think they just want to listen to me. But I'll be giving away some gift for those who are very patient and listening along the line. So today's zone, I'm just going to give. It's going to be a lucky tip for everybody. So I'm just going to scroll some recharge card, airtime. This one is brought to you by Ask the Paediatricians Foundation solely. And then, so I'm just going to put in some airtime numbers so you can recharge them and let me know if you are the one that won my card, courtesy of Ask the Paediatricians Foundation. So I will start before I go on talking. So if you win, but please continue to listen. Or don't because of hair type, don't remember. But I'm giving you notice now. So the first one coming up is Glow. So those of you who are Glow subscribers watching me, just get ready. Okay, so where was I? So I was talking about ways by which we can get HIV and ways by which children don't get HIV, so we don't get it twisted. But the good news I have for us this morning is that HIV in children is completely preventable. In fact, we are working towards getting HIV transmission in children to 0. So we're going to talk about ways, and that's why this is important for us to talk to parents about, because we want parents to understand that we can have a generation, a 0 HIV generation, and that is the campaign that UNICEF has started. Because if you look at the ways I've told you by which children can have HIV/AIDS, I mean, you can see that it is likely preventable. In other words, if a mother is not pregnant, I mean, if a mother is not HIV positive when she's pregnant, then she's likely not going to give her baby HIV. And even for mothers that are already HIV positive, that does not mean they can't have children. In fact, we already have methods by which we can prevent HIV/AIDS, even for mothers who are already positive, so that their own children cannot have HIV. So for such mothers, we usually recommend that they on medication, what we call highly active antiretroviral medication. Even if you are not on medication because of your own disease, the fact that you are pregnant and we want to prevent you transmitting the virus to your unborn child, we will put you on medications for that. And usually, sometimes if you are already on the medication, you may continue that medication throughout until after the baby is off breast milk. So we find out that when you use medication and then we do a delivery that is very well controlled, before we should recommend cesarean, but these days they say you can even have normal delivery, but it has to be well controlled. And then before we used to say don't breastfeed, but now we say you can breastfeed as long as you're on medication, because when you're on medication and the viral levels are very low, the chances of your baby getting the HIV is very slim. So let me backtrack by saying that it's not every HIV positive mother that will give birth to an HIV positive baby. It is not even 100%. In other words, even without any form of protection or prevention, it is not 100% that once you are HIV positive, you must have an HIV positive baby. Sometimes your baby may not be positive. You understand? But with prevention, with all this method, we can even reduce that risk to less than 2%. That's it. But the ultimate prevention is when our mothers are not even HIV positive at all, and the fathers are not HIV positive. Then we know that we can have baby. So if anybody has won my recharge card, let me know so that I can put up the next one. Okay, thank you. I hope that is very clear. So, so the ultimate thing is for we as adults to know our HIV status. And so that's why you keep seeing all the promo slogans, know your status, go for your test. Because when you know your status, the reason why some babies have HIV is because even the mothers are pregnant, they don't even know they are HIV positive, and
Yeah.
they've not done any tests. So some of them, it is during delivery that we discover that they are HIV positive. Because some of them don't also come for antenatal care. Some people just believe they are fine, they don't need any antenatal. So at the end of the day, so they may not have any so it was during delivery that doctors discovered their HIV positive. So it is during that time that we are now able to uh, start the prevention, but it's a little bit late. There are things we can
Yeah.
still do at that stage during delivery. Then we can also give the baby some medication as well. So, but these are some of the ways. But if you as a mother, you already know your HIV status, if you are negative, we'll be very excited that you're negative, and then we will say, don't maintain it that way, so that as you're going pregnant throughout, because you can be negative at the beginning, but you also, if you're still sexually active during the pregnancy, or you get blood transfusion, you can still get HIV infection. So, but if you maintain it that way, that would be lovely. Then your baby will not likely have HIV. And but if you are positive, then we'll recommend that, okay, these are the ways by which you can prevent the infection, and that will be by you taking your what we call highly active antiretroviral medication, making sure you are monitored during delivery, so that delivery is as bloodless as possible, and then also breastfeeding. But when you're breastfeeding, it's either you are on medication or your baby is on medication, or both. So the most important thing is that we are trying to prevent that baby. And usually after 6 weeks, we will test the baby. And most of the time when we test those babies, most of them are negative. Like I said, we can reduce the transmission to like less than 2% if the mothers are known early enough and they are on those preventive medication. So you can see, for those of us in pediatric HIV/AIDS can actually be a non-existing thing, hopefully, and that's the campaign, the
Yeah,
ambitious
I
campaign
think
that
you're more in control of HIV and AIDS, the pediatric HIV. Yeah, you're more in
yes,
control
yes,
because it's
yes. So, and the way we test children, so we can
not
test
like the
them.
child is it's not like, so it's, if you control the birthing process, like, makes a lot of sense.
Okay, so we can, and then when we can test children, and even if for any reason children, of course, some children still have HIV/AIDS, as per, despite either because the mother didn't go through the prevention method of what we call prevention of mother to child transmission (PMTCT), or the child gets infected through blood transfusion. Because there are still a lot of, especially in our own country, where there's people do a lot of shortcuts, shoulder things, because ideally all blood should be screened. Ideally, all blood should be negative, but sometimes people just get blood from random places so they can get infection. Or sometimes, we've heard of children being raped and things like that, so they can also get
Yeah.
HIV from that, or through instruments. That's why we usually recommend that children be careful with sharps with children. It's better not to allow children to have access to blades, scissors, or things like that they can cut themselves with. And when you take your children, for example, to the barbing salon, it's better you have your own hair clippers, things like that for them. Let them not share with. Though most of the barbing salons and hairdressing, they've been educated on sterilization of
Yeah.
instruments and all that. Actually, the HIV virus is a very weak virus. It doesn't survive too long outside the body fluids environment. But you still have to be very careful. So those are the ways. But if a child still now gets HIV through these other ways, we can also treat these children. So HIV is now becoming what we call a chronic disease. In other words, just like having diabetes or having hypertension, people can live with it for life, and but they will just have to be on their medications. And when they're on the highly active retroviral medications, they can actually live and they'll be fine. They will not be having any major problem. So the major problem with HIV is that it destroys your immune system, so your body doesn't is not able to fight common infections and things like that. So but now that with medications, the virus can be suppressed, so that even though it is not completely cured because the virus is still there, but it is suppressed, and then you can really live a relatively healthy life, And so people are working towards a cure right now, but we don't still have a cure. All right, I'll stop there. We can ask your question. I don't know whether anybody has
I
returned.
think I have a question. although
Yes.
you have talked about it, but I want you to just maybe emphasize it on it again. Two questions, really. So you're saying that in some cases, even after your well-controlled birth process and all of that, children may still have the HIV/AIDS virus, and then they have to just live like that forever. That's a bit scary. Will a 5-year-old or a 7-year-old, for example, remember to take a medication if the mother or father, if they are not very careful people? So what's the hope for that kind of a child?
The fact that, like I said, people having the HIV does not mean it's not a death sentence. They can still live a normal life, but unfortunately, that's the honest truth. The children will still have to live with it for life. That's the honest. I mean, that's the truth. There's nothing we can. As at today, there's no cure for HIV/AIDS. So if you have HIV/AIDS, you're going to live for it forever.
Wow. But I think a lot has been put into this thing, really. So it's getting better.
Yeah, it's
I
getting
mean, it's
better.
not as
Yes. Before, when I
you went
Yes.
ago.
When I started, when I was in medical school, when I remember as an house officer treating a 19-year-old with HIV/AIDS, a student, very brilliant student of University of Lagos, and the child died. During that period, even those of us who are healthcare professionals, when we have people with HIV/AIDS, everybody is so scared to come near them. Everybody is so scared to do
Yes,
anything for
yes,
them. Like
yes.
you're abandoned, it's like a death sentence, that kind of a thing. But these days now, with all the support that we have and everything, people can live relatively normal life with HIV/AIDS. So it's not a problem. So there are a lot of people living with HIV/AIDS, and there's nothing wrong with that. Okay, so that's that. All right, so I think I've put up another set of head time. So if you have won my head time, does anybody won my glow? Or those who are glow subscribers are not watching if you like, you can you can you can let me know in comments if you win. Please let me know. There's also a Etisalat and there's also Excel. I think I will get the MCN very soon, then I'll share with you. Okay, so please, if you have questions, ask about the questions so that I won't just keep talking. I want to hear from you, and you can ask me your questions and I will answer them while we continue. So while we continue, one of the common, I will talk about what are the symptoms that sometimes some people, maybe they didn't deliver in the hospital or things like that. So they may not know when children have HIV. So what are the common symptoms? For us, in the newborn period, children who are infected tend to be sick a lot, And one of the reasons why I always say, for example, people will post a picture of a child with oral thrush, for example. Okay, somebody has won my Excel. Okay. Alfusat, Adam, congrats. I'll show you later, but I want the other people to load the rest so that I won't take it off. Okay, so one of the major symptoms you tend to see is that child will be very sick. And one of those things, sometimes people have what we call oral thrush. So, like, for example, when people post picture of oral thrush, they will just say, oh, go and use it. Like yesterday, somebody hijacked our post and they were just saying all sorts of things. People don't understand that there's a reason behind some of these things. So, if a child has that, we really need to be sure that that child does not have underlying immunosuppression. It's not only HIV that can cause immunosuppression, yes, but there are other causes of immunosuppression. But we need to be sure, and that is why we always say you have to go to the hospital. It's not enough for us to just say, go and buy Bonjela, go and buy Nystatin, or all those kind of things that people say. But we need to know why is this child. That's more important than just treating the infection or what is obvious to you, but to know why a child is having that. So if we see a child who is falling ill, who is having fever for like over a month, child is having fever every day, or you see a child who is having diarrhea every day for a month, or you see a child who is constantly sick, those are signs that that child needs to be investigated. And this day we even do what we call, we kind of opt everybody in. Once you are coming to the hospital for everything, we ask you to do your HIV status. It's not compulsory, but we try to ask you so that we will quickly be sure. And it's important that everybody know their status. All right, thank you so much. So we'll continue. Okay, so what's her name now? Afusat Abiola. She has won our Excel. Thank you. Has anybody won the Etisalat? Has anybody won um the glow? So I don't think we don't have anybody winning that one now. Okay, so our moderators, if you have questions on the ATP watch party, can you just please bring it up for us so that we can ask? So I'm going to, while we're waiting for that, I'm going to put up one MCN now, so that the MCN subscribers can also have their own part of it.
Okay, so moderators, please go on the watch party, get the questions out from the watch party, and then post on the page video. You know what to do. Please quickly do that so we can have the questions move from the watch party to the video on the page.
I don't know why. I think maybe people are scared to ask questions because it's HIV AIDS. And that's one of the things why we have to talk about it, because there's a lot of stigma around HIV AIDS, especially in Nigeria. People like, I don't want all these moderators that are winning my.
Somebody might feel that, why are you, why will I, if I ask questions now, somebody might think I'm asking for myself or for my child. So I mean, I think it's just, I think we should grow out of that and ask questions. The information is very key.
Yeah.
Very important. Okay, Dr. Bede, let me ask you a question. If a woman is HIV positive and then she has gone through the hospital, has helped her, she's taking her medications and all that. Okay. I mean, if she now misses the medication for 1 day or 2 days, is there any problem per se?
Okay, yeah. So usually the HIV drugs are not the very easiest of drugs to take, because we have what we call prevention. If you as a doctor, for example, if you get pricked, or you are an health worker, you get pricked, yes, with somebody who could likely have HIV. We don't even know, because HIV is not written on forehead, so you don't know who has HIV. So if you have been exposed, needle stick and all that, you really need to be careful, because they will put you on what we call medications to prevent you having HIV, pending when we know the status of the person. And most doctors who have taken it, luckily I was lucky I never had to take one throughout my career, because most of us then as health officer, we end up having to take that medication because you are still very new and you make mistakes. People that have taken it described as the very horrible drugs to take. So it's very easy for people to want to stop the medication, not want to continue and all that. But the challenge with that is that when you don't take the medication, the chances of you developing what we call treatment failure is quite high. You understand? In other words, people who miss the medication, who are not, we call it adherence. We have a lot of times we use a lot in HIV medicine. So adherence means you have to take your medication every day. So, but people who don't take the medication every day, they can have what we call treatment failure. Treatment failure means that even though you are taking your medication, the virus will still keep multiplying, the person will be sick and all that. But usually when they're on medication, they are being monitored, the viral loads and some other blood tests will be done regularly. So if the viral load is indetectable, that means that you are well controlled. And those are people that will live like every other normal person. You know, I mean, what I mean, I live like as if they are healthy, you know, they will be apparently healthy, they'll be fine. But if you are not taking your medications regularly, you have treatment failure, the viruses will multiply. And unfortunately, what happened with that the medication you were using before may no longer work again. They will not be effective again. And then we have to go to what we call second line drugs and things like that. By the time we're going to that, it's becoming risky. You know, it's a death sentence because your medications are not working. It means the viruses will multiply, and then it means you will go on to having what we call AIDS. Now, I need to really make a difference between the two. Yeah, because sometimes we tend to say HIV AIDS, but HIV is a virus in your blood itself. AIDS is when it has now destroyed your immune system. So it is not everybody who has HIV who has progressed to having AIDS. So most of the picture we see those early days that people look so very malnourished, emaciated, very ill. Those are people that already have full-blown AIDS. But majority of people who are walking around, though they are positive, just have the infection. So there are grades that you must be sick. You must have some symptoms from illnesses for us to say that you have AIDS. So, but we will call them staging. So we have stage 1, stage 2, stage 3, stage 4. So stage 3, 4, and 4 are the real very ill people, and those are the people that really have what we call full blown AIDS. So those are some of the other things that we really need to know. So it is important that when people start their medication, they are adherent to it. So usually they have support. Their nurses are there to support them and all that. So that they don't develop treatment failure and they don't have any issues after that. So, okay, Khadija Sadenike has won the Glow. Has anybody won the Tisalat? Let me know. Has anybody won the MCN? Let me know. Okay, I think we have a question here.
Okay. Lilyville. Okay, she's saying, is it possible for a baby's head? Oh, this question is
yeah, it's not HIV, but we'll answer it.
Okay. Is it possible for a baby's head to be hot, but on checking the thermometer, it shows the normal temperature of 42.5?
Yes, definitely it's possible, because obviously I guess that's what happened to you. But there are two ways. It's either the baby's head is actually not hot. In other words, that's why I always tell mothers, your hand is not an instrument, and that's why they invented the thermometer, because if we go by your hands alone and it's always accurate, then we don't need the thermometer. But because we always know that your hands, sometimes if you are hot and you touch somebody, you would think the other person is hot, whereas you are the one that is actually hot. So that is a possibility that the baby is not hot. Maybe the mother is hot or whatever, or it's just your own perception. That's one. Number two is that your thermometer could be faulty. So if, for example, a child is really very hot, everybody thinks this child is hot, and your thermometer is still low reading, then that means you need to use another instrument, because it's an instrument. It can go faulty. It can I expect you to use your judgment. You can recheck it again and all that, but most thermometers, they're very, very accurate. So if the thermometer is reading nothing, and sometimes mothers, see, when babies are eating or doing some other things, they are using their brain actively, there's more blood flow to the head, so the head actually feel warm. So, but mothers always think it means baby is having fever. No, because I always get this question: my baby said it's hot. There's the part of your body that feels hot determines the part of the body where blood is rushing to. But if a child really has fever, it won't be the head only that will be hot. It will be the whole body will be hot. So if you think it's only the head that is hot, though of course you can start from the head and go to the rest of the body, then most likely the child and the temperature is also not supporting fever, then most likely it is just the blood flow to the head, and there's really nothing wrong with the baby. Like if a child is sucking actively, they're using their head, the blood flow more to the head. When your baby is digesting food, blood flows more to your stomach. So if your baby's head is not hot to you, but the thermometer, you are very sure it's accurate, is saying no, then I will go with the thermometer, because I think it's more accurate than your body. Than your hand, rather. Okay. So yeah, so we still don't have questions. So people are not asking. And people that have won my recharge card. Talk. Has anybody won the MCN and the what's the other one? I think I've shared MCN. I've shared the Tisalat. So if you have won, let me know. People on the watch party, I hope you saw the recharge card. Yes, they will have seen it. So you will have won. Okay, so I was talking about, I've made a difference between HIV and AIDS, and I've talked about the symptoms. Let me just say there's treatment for HIV/AIDS. We have we have drugs, and these drugs luckily are free. Actually for children, they are free. So if your child has HIV, it's free. Another condition that tends to occur like a twin brother or twin sister, if you like, of HIV is tuberculosis. So anybody who has tuberculosis must be tested for HIV/AIDS, and anybody who has HIV/AIDS must be routinely also checked for TB. And luckily, these drugs for both conditions are available free in the government hospital. So, and please, for those of us who are here listening, know your status, but please don't stigmatize those who have HIV/AIDS. I guess maybe that's why we're not having a lot of questions, because it was like last week when we were talking about dietary stuff and all that in children, we were struggling to keep up with the number of questions that we're having. But you can see now everybody's really quiet because I think people don't want to ask questions, but that's fine. You can send us your message on email. You can send us your message, via our email. You can send us your message online on our group, but you can yeah, okay. I think it's better you email it to us so that it will keep your anonymity and all that. So, because somebody has asked us a question about HIV recently, and she was asking that the child has changed medication, and that's one thing with children. Children, for the younger children below 5, 7, it's very easy for them to be adherent to their medication because the parents give them the medication and they take them. But as the children grow older and they are now teenagers, it's become more difficult because the children, they begin to ask themselves, why am I why am I the only one taking medication? So you have to do a lot about disclosure. That's another aspect of it entirely. Disclosing to the children. Do you have to tell them? Do you not tell them? I will answer that. But somebody is asking a question here.
Okay. Morning, Aisha Umar Babati. She's saying, morning, ma. Some mothers are positive and yet they breastfeed. Ooh. Maybe she's asking why. So she's just joining in.
Yeah, you're welcome. Yeah. I will answer. Okay, so let me leave the question so that people will know what I'm answering. Okay, she meant why. Okay, yeah. She said she meant why. Okay, so Aisha, thank you for your question. Thank you for joining us this morning. Like I said, when we first started this HIV journey, like how many years ago now? Is it up to 30 years ago now? Initially, we will say no breastfeeding, no normal delivery through CS and all that. But now we've learned a lot. We've done a lot more researches. We know so much. We actually found out that babies that are not breastfed, they die more. Not from the HIV. No, the HIV is not what is killing them. They die from diarrhea. They die from all the problems of bottle feeding. And we in Paediatricians, we always talk about breastfeeding. People did research for years and they found that these babies were dying. It's not even the HIV that end up killing. Most of those babies did not even have HIV because we tried to prevent the HIV. So they didn't have HIV, but they were still dying from the problem, from diarrhea, from unsafe water and all that, because our problems are not just about the HIV, the water. There are things that kill people before HIV will kill them. I'm telling you, especially in Nigeria, you'll be surprised that most of our children's deaths are not HIV deaths. Most of our children are still dying from malaria, from pneumonia, from diarrhea. Those are things that are killing the children. Only very few of them die from HIV/AIDS. Very few indeed. So they now did research. They now found out that it's not just the HIV. It is the breastfeeding that those babies are missing. And we found out that if a mother is on medication, a viral load can be so low, so undetectable even by the machine, that she will not pass on the virus to her baby. So they've now found out that if a mother is on medication, highly active antiretroviral drugs, and she breastfeeds, her baby's chances of survival is better than if she's doing what we call substitute feeding, exclusively bottle feeding, formula feeding, no breastfeeding. And that is why the WHO recommendation changes, and they now say breastfeed your baby but take medications. In fact, you start taking the medication from pregnancy, you continue, and you must continue the medication as long as baby is on breast milk. So you have two options. You can breastfeed exclusively for 6 months and stop breastfeeding completely, and then just change your baby to complementary food and all that. Alternatively, you can just keep breastfeeding, but you have to keep taking your medication. So that is what is recommended. So these days we don't recommend anymore that don't breastfeed like we used to do that before, but we have stopped now. So what is recommended now is for people, for mothers to actually breastfeed their children. I hope that is very clear, Aisha. So it is good. So we recommend exclusive breastfeeding.
We got that, Aisha. She's saying, I mean, why? We got that. I'm sure you've gotten Dr. Boyede's response already.
I don't know whether anybody has won our MCN. So if you have not won, I've not had
Glow and one Etel, I guess. One Glow and one Etel.
Yeah, one
so we have
one Glow. So I think have from the Etisalat and the Etisalat subscribers and the MCN. So I'll post the MCN all over again, and then I will ask you to let me know if you want it. Okay. Okay, I think I need to refresh. Just a minute. Okay, so I'll post our MCN again. If you want, just let me know, and then we can go on. Okay, so if you still have questions, ask us. And moderators, are there people not asking questions on the watch party? If you have questions there, please.
Okay, so maybe I'll just go there and take the questions from there.
Okay, I thought I saw moderators there, but they seem to be more interested in telling me they won my recharge cards. Okay, so somebody has won the MCN. Okay, Michael Olugbengashile. Okay, I got the MCN. Correct. Right. I have 2 MCN, so there's another one. So, if you have won the second one, let me know as well. We have very limited time. Don't start asking your question when it's time to go home. Ask your question
that's
now.
What I've just seen now.
Yeah. Okay. Vera, you can go ahead.
Okay, good. So from Hamid Miriam, she's saying, please, how can I improve the appetite of my 4-year-old that doesn't like eating? She weighs 13 kg the last time I checked, or rather she weighed 13 kg the last time I checked. How can I improve her appetite? She's 4 years old.
Okay. I'm struggling to know whether I should answer your question, whether you should, because I don't want us to derail this topic from what we're really talking about, because today we're really talking about HIV/AIDS. So, but I know we get a lot about appetite questions. So if you go on our group, there is a whole lot on complementary feeding. If you go on our website, there are tips on how to improve healthy eating in children. It has to start early. And if you also go on our past ATP Live, I think we talked about some of these things last week and maybe previous. Yeah. So because it's a long question, and because I also don't want people to start thinking we're talking nutrition today instead of HIV/AIDS, I would just say please try and ask on the just go to the group and post it, or just check out all the previous editions and listen, and you will get the full details of that. But I really want people to ask me questions about HIV/AIDS today. Thank you. All right. Thank you so much.
There's someone already. Yes.
So that means our moderators, you are not helping us copying some of these questions. So I'm surprised we are not saying them. Okay, so somebody got the Etisalat. I have 2 Etisalats and 2 MCN. She got both of them.
No. She got one. She said I got one of the Etisalats.
Okay, thank you. So lots more people are watching. Thank you.
Okay. So someone from the watch party.
When you copy, please put it on the direct video, because maybe some of our moderators are copying and putting it also on the watch party. I've seen that a couple of times. Okay, all right. Let's just go on. Somebody is asking a question, Vera.
Okay, is it there already? Good. Okay, so this is from Isaac Peace. Hello, doctor. Is it for children below the age of 6 to be given punishment in school, like sit in the chair? Because after that punishment, my son always complained of pain while he waked first thing in the morning. and finds it difficult to walk, is it something I should worry about?
I think you should go to the school and discuss with them. I mean, if your child is getting punishment that is creating physical illness, I mean that is not acceptable. So I think you should go to school and clarify with them. All right, but we'll not go into detail because that's not our focus. People are not asking us questions about HIV, so they're only
Yeah.
asking us about breastfeeding and
Someone
all
says we should talk
that.
about hepatitis B, and someone else says we should talk about conjunctivitis.
We'll take in that for our next year's planning. We will be ATP will go off on the 23rd or the 24th of December. So we'll be off completely to January 7th. And when we come back, we would have done our plan for the 2019, and we'll let you know all the topics. So I think we'll put up a post on the group to say what are the topics you would like us to talk about in 2019, either in our group discussion or on HCP live and all that. So you can give us that feedback, and when we are making up our topics, some of the topics you're asking us to do, we actually have done them previously. Yes, well, we can do
Yes.
them again, so we can revisit them as long as you are interested in them. That's our job, to make sure that you are well informed, you are well educated. And I also want to let you know that we're going to have an app, Ask the Pediatricians app, very soon, where you can actually post your questions, check some of our, and you can easily get it very fast. So you don't have to wait for our moderators, you don't have to wait for Dr. Baby. You can just put your question in and you're going to get it immediately. So that is coming up very soon.
Well done, ma'am.
Yeah.
Okay.
Okay,
So we
so
have Olasheni. My baby girl would not just take breast milk. She's 10 months old now. Please, what's your advice?
my advice is to know why your baby is not taking 10 months. I mean, your 10-month-old is just refusing breast milk. I know I have a suspicion what could have happened. Usually, most of the time, because when you start your babies on complementary feeding, you stop breastfeeding. You don't breastfeed for so long. Maybe you go to work and then they just breastfeed. After a while, the child doesn't even recognize they need to breastfeed anymore. So they just want to go for something else. So, but if you make out more time to breastfeed, or you can express the breast milk and let them give it as well. So it's fine. But your baby still need breast milk. Trust me, your baby still need breast milk, and we recommend that you breastfeed up to 2 years. I don't want to keep, okay, but I guess I have no choice. Okay, I think I've answered this one.
Well, you've answered that. Okay, it's almost okay. Let's see what Foluke
I think, okay,
Sonmi.
this is the last one. After that, we'll just, because people are not asking me about the topic of the day.
Is it good to always give children, e.g., yogurt, Capri Sun, with biscuits daily in their lunch pack
It's not
to
good.
school?
You can give yogurt. Yogurt is good, but the other ones are not okay. You can give fruits as alternatives. That's what we recommend. That's what we recommend. All
Okay,
right.
Dr. Brede, we're
Yeah.
rounding off
Well,
soon, but
time
you need
is
to go
up.
back to there was something you wanted to talk about. How do you tell it a 5-year-old, an 8-year-old, a 10-year-old that you're actually positive? You were going to tell us about that.
Okay, so we recommend for parents to start doing the what we call disclosure. We usually call it disclosure. Um, Disclosure means letting children know that they are HIV positive. And for children, you can't just tell them you are HIV positive or you are on medication. The children will go to school and go and tell their friend. They don't see it as anything big deal. And then those children will go and tell their parents at home, "Oh, my child is."
They don't talk first.
Somebody said my friend is HIV positive on medication. And what happened? Parents start taking all their children out of that school. I mean, parents are that mean. Yes, they will take all their children out of that school. I've had it. I think I've seen one. So,
Okay.
so or even the school people will say, "Come and take your child out of this school because all our parents are leaving because of your child." I mean, where are you a teacher? You know that can
Yeah, but
happen.
I'm just trying to think about in all my years of teaching, we haven't had such issues. I was going to ask you a
Yeah.
question. When you're done with this, I'll ask you a question.
Okay. So, but it has happened, I can assure you. So, what we now do is that you can't just tell a 5-year-old you have HIV, you're on medication. You can just tell them you have a disease and you need to be taking these drugs so that you'll be healthy. just like every other person take multivitamins. So just tell them you are taking this medical, because children are going to ask you, because they're going to take these drugs every day for life. So it will come to a time. It's not like the way you give anti-malaria for
Rest
3 days
of
and
us.
that's the end, or you give antibiotics for 7, 10 days and that's the end. Now they are going to be taking the medication for life. So you really need to let them understand why they need to take the medication. So you can even start by telling them, okay, you know, when we have some condition, we take medication so that we can be healthy. You don't have to mention name. So, but usually by the time they're about, so you started building the child up towards knowing that the
Was the
child is having a condition and all that, then by the time they're about 7 or so, you begin to tell them, there's a germ. You don't also have to say it's HIV. You can tell that you have a germ in your blood that is fighting your blood and you need to take this medication to fight the germ. So the child understands that. And preferably you give the medication yourself at home so the child doesn't have to take it to school, or the school doesn't have to be part of it. You understand? So these are some of the
yeah.
things that you can talk about. So, but by the time they're about by the time they're about well, it varies from children to you yourself as a parent. You should be able to gauge when your child is ready for that full
Such
disclosure,
information.
and that full
Yeah.
disclosure you can tell the child, oh, you now have this condition. Because you have built up the child gradually and all that. The most challenging period is the teenage years, because teenagers naturally want to challenge you. I won't want to say rebel. They want to challenge you. But if they
Yeah.
have been built up to understand why they have to take the medication that's for their own good and all that, most of them will be compliant, will be adherent. So sometimes even in the HIV clinics, they organize program for teenagers. Teenagers generally don't like taking medication. They don't want to be different from their friends. They don't want to be taking medication while their friends are playing a football game or something like that. But they need to take it. But you have to. So you have to start early to build them up, because at that point you won't be able to force them to take it. You rely on them to take it by themselves. So if you don't take time to have
Explain. Let them
prep them
understand.
and all that, they need to be quite difficult. Yes. So I can see a lot of
True.
questions
True.
that are not
True.
related to HIV. What I would recommend that please post your question on our group. Just post it directly. We will answer them. Your questions are quite important, but we're talking today about HIV/AIDS in children. So, but post your questions on the Facebook group directly, and our moderators will answer them for you. So, thank you very much. Yeah.
Yeah. Thank you so much, Dr. Boyede. So I was saying, um, as a teacher, I was wondering while you were speaking, do you think that the teachers actually need the information? Because okay, at the point of entry, information like okay, my child is asthmatic, of course, so you know what
Yeah.
part of the class the child will sit and all of those. My child has this. My child has it has to wee more frequently than other children. So we get such information. Do you
Yeah.
think that we're ripe enough, we're mature enough to have that information about HIV? Do you think it's important? Is it necessary for parents to give us such information?
Okay. Yeah. Let me first start by saying that disclosing somebody's status is voluntary. It is up to that person. Let me even shock you. It is not. I, as a doctor, I cannot even tell the wife or the husband of somebody who has HIV/AIDS that your wife is
Yeah.
positive. I can't, because it's unethical. Because I sometimes see people posting on Facebook. I think I've seen that before, where somebody actually posted on Facebook as about somebody is HIV positive. It is actually very wrong. It is not ethical. It is, the person can sue you for it. So it is
Okay.
up to each person to disclose their status to whoever they want to disclose it. You as a doctor, you as a teacher, you have no right to know unless they tell you. And even if they tell me, I have no right to go and tell another person, even if I think that person may be at risk. So there's some ethical
Yeah.
dilemma
I
like
was going
that.
to say
Yeah,
that.
but I will try to encourage the person to say disclose. So your question also comes under that category. So I think it's good for the school to know. For me, I think it's good for the school to know, so that the school can be very careful with some preventive measures, not to stigmatize the child. But you see,
No, at all. Yeah.
but the fear of the parents is that their children are going to get stigmatized if they tell the school
True.
or other parents or
True.
the
True.
school. And sometimes, I'm sorry with apologies, but sometimes some of us teachers. Vera, I know this may sound like I
And
don't know,
yeah,
but I know sometimes some
well,
teachers will tell other parents what another parents have told them
yes,
with confidence. They will just say it, because some parents are very close to them. They bring them gifts and all that. Then they begin to tell them, "Oh, that
yeah,
child, this is how their mother does. This is how I've seen that,
yes,
and it is
yeah.
wrong."
It does happen. You know,
Yes. So you cannot imagine somebody go and tell you a child is HIV positive. Some mothers is going to, some careless teacher, let's not say, will likely go and tell another mother. Then that mother may begin to spread the news. And before you know it, everybody is either taking their children or they are stigmatizing those children. So we want a world that is free of stigma. And I think that is the fear that people have, that they will they will likely not be, their children will likely be stigmatized, and that's why they don't want to talk about HIV. Yeah, Vera, welcome back. So that is the
thank
most
you.
important thing. Yeah. So
Yeah,
we don't, if a child is healthy, the child is fine, well, it is up to the parents to disclose to you. But if they don't want to disclose to you, I'm sorry, you can't force that information out of them. And
that's true. I
and I
completely
don't think
agree.
there's a
It's quite
law that,
balanced.
you said?
I said it's balanced. What you've just said is quite balanced. I mean,
Yeah.
if the
There's
teachers
no
are not
law that
talking
also
to,
said people must disclose their status. But there's a law that says
yeah,
you must not deliberately put other people in place of harm. In other words, so if you know you're HIV positive, you can't go sleeping with
okay,
people without letting them know
okay,
that you're HIV positive, so that because that is you want to infect them. And if you do
true.
that, then you are likely going to you can be sued for, it's like trying to put somebody in a harm's way. So
Intentionally,
if a
yes,
child is in a school and the child is not doing anything, like that, so what we recommend for teachers, what I'll recommend for you is that practice it as if everybody is HIV positive in your school. That's the key thing. So if a
I didn't
child,
hear that.
most schools have nursing base and all that. So if a child get
Yeah,
themselves caught or something like that, please don't just say, "Oh, it's a
yeah.
child." Just use your bare hands,
Just
clean blood. Use your hand.
don't do
Don't
that.
practice universal precaution. Wear gloves. Do what you would do when you are dealing with somebody who is HIV positive. Don't allow children to use blade. Please, this is very wrong.
Yes,
Let the parent be the one to
yes.
sharpen their pencils for them. I see when sometimes some teachers will say bring
Even,
sharp blade, razor blade, because the sharpeners are always very frustrating for to use to sharpen pencil.
oh no. Well,
But
I can't say it
it could be
happened in
very
some schools.
dangerous.
Yeah,
It could be very dangerous. And please, we also want these teachers to educate our children about HIV/AIDS and
yeah,
let them know there are other children like them living with this condition, and let them love them, let them support them, let them not stigmatize them. Most parents try to give the
yeah.
medications at home, so and usually most time once a day. So you teachers are not involved in giving medications, but it's just
Yes,
like any other
yes,
child. Like we have children who have diabetes and they need to take their insulin. You have children who have asthma and need to take their inhaler. People with HIV/AIDS also
yeah.
they just like any other condition, and it is not the fault of the child. So
True.
if the child is not promiscuous, the child is not
Well,
anything. Yeah, and it may not be the fault
emotional
of the mother. It may not be that the mother is also promiscuous. People always think HIV/AIDS means you're
yeah,
promiscuous. No, people get blood transfusion and have HIV/AIDS. People get sharps and have HIV/AIDS. So it's not everybody who have HIV/AIDS who is a process, who is into, you understand? People always think like
true.
that, and it just take one exposure to somebody with HIV for you to
Yeah,
have HIV. It doesn't mean that you have been sleeping around or things like that. So if we think about it from that perspective, then we'll realize that there's no need for us to stigmatize people
okay.
who are living with
Yeah,
HIV.
that's
So
the
I think our time is up, but I'm just going to conclude and give this summary note. So we talk about HIV/AIDS in children. I will say children can have HIV/AIDS. We've said that most HIV/AIDS cases in children come from mother to child, either during pregnancy, during delivery, during breastfeeding. But a few
yeah,
percentage also come from blood transfusion, unsafe blood transfusion, sharps exposure to blood or things like that. Even things like circumcision. That's why you have to be very careful where or even hair piercing. Those kind of small procedure they can
yeah.
introduce children to HIV/AIDS.
That's
But we are saying that we can get HIV/AIDS to zero in children. We can get HIV/AIDS to zero in children. And the way to do it, number one, is for we as parents to know our own status. If you know your status, the fact that if you are negative, please maintain it negative. And that way, children will never have HIV if all the parents are negative. Alternatively, if you are already positive and of course you still want to have children, you must be ready to go through the preventive strategies. So we have what we call prevention of mother to child transmission. We may need to put you on medication, you may need to do certain things. But if you do all those things, the chances of your child having HIV/AIDS is almost zero as well. So those are the ways by which we can prevent it. So it is not a death sentence. And UNICEF has kick-started a campaign, and at the Paediatrician Foundation, we support that campaign that we want to get to a zero HIV generation, a generation where people don't have HIV. But while we are working towards that campaign, please don't stigmatize those who already have HIV. Show them love, support them. Some people are bold to say I have the virus. Some people are not bold to say it, but whichever way, please let us support them. Thank you so much. I think that's the final question on HIV/AIDS. I'll just take. Yeah. So it's very important I take this question. Very sorry to bother you. Oh no, people are not asking me questions when I finish the program. Okay. All right. For Aisha's question, if the CD4 count is high, do I stop medication? No. The answer is no. Please don't you ever. We never stop medication. As at this moment, we are not stopping medication on HIV/AIDS because we have not yet gotten to the cure of HIV/AIDS. So which means until we can declare people cured and we say they don't need medication, then that's when we can stop. That you can be very free LD, you can have no virus in your blood, but as long as you have had it, you must keep taking your drugs because it is that medication that keeps the virus what we are doing is suppressing the virus from replicating. We have not destroyed the virus itself from the blood. So if you stop the medication, the virus are going to come back, and this time around it will be very difficult for us to control them. So please don't stop medication. I have to sound that because people do that a lot. Sometimes we prematurely stop. Oh, the child is okay, then we stop. We're actually causing more harm. It's for now, treatment is life. That's the honest truth. For now, treatment is life.
Okay, so we'll go back with that. Treatment is life.
Okay.
Can we take one question?
Yeah.
Okay, Doayola Adimeji. Hello, doctor. Is it possible for an HIV negative mom to give birth to an HIV positive baby? Plus, can such a baby transmit the virus to the mother?
No. An HIV negative mother cannot give birth to an HIV positive baby. The baby must have gotten HIV from somewhere else. But there are many ways the baby can get HIV. I've told you there's blood transmission. I remember I was part of a case that was really popular then, where we have a baby in my former hospital and the baby was positive and the parents were negative. It was really a serious issue. And we were able to trace it down to the blood transmission that we gave that baby. But we were able to sort it out. Anyway, so basically, if a mother is negative and the baby has HIV, then it means the baby gets it from those other what do you call other means of transmission, and the baby can the baby transmit the virus to the mother? Very unlikely. I've not really read of a case of baby to mother transmission of HIV. That would be an interesting case, but it's very unlikely. Very unlikely. Because there's nothing the baby is giving to the mother. Baby is not giving blood into the mother. Baby is not giving breast milk to the mother. Maybe if the baby has a wound, theoretically, if the baby has a wound and the mother has a wound and their blood mix, it's a theoretical thing, but it's very, very unlikely. It's very unlikely. So anyway, let's just stop it like that. Okay, so thank you so much for everyone for joining us. Please always let us know our questions early. Maybe we should be asking people to drop their question before the program, so we have their questions already, and then they can also see ads. Maybe that will make it easier.
We want to try that next time. Okay, Dr. Boyege, thank you so much for joining us today. We appreciate you so much. And to our viewers, thank you for joining in. And like Dr. Boyege earlier said, there are some questions you might still want to ask. Please go on the group, Ask the Pediatricians on Facebook, and then click on the join button if you're not a part of us already. But if you're with us already, you could just put your questions from Mondays to Saturdays, type your questions in, and our professionals and moderators will be very willing to attend to your questions. We have our live shows on Saturdays at 10 a.m. every Saturday. So next week, Saturday show, we'll have another interesting topic, and please join us on time so you will not miss out on the show. Yes, this show is going to be saved on the group wall on our YouTube page. So you could go subscribe to our YouTube channel, which is Ask the Pediatricians. Dr. Boyede, can we have those on the screen?
Okay, I'm
so
trying to get it out for
Yes, so
us.
subscribe to our YouTube channel to watch this over and over again. You could share with your friends, invite people, send the link to people to watch after today. Of course, you won't have the airtime again, but of course, you won't be able to ask questions again, but you'll be able to learn. Okay, so that's our foundation page, Ask the Pediatricians page. Then we have Ask the Pediatricians group. And then, okay, for questions that are sensitive, you want to ask questions about some things you don't want people to know about, you don't want to attach your name to it on the group wall, you could do that via our mail option. So send an email to ask@askthepediatricians.com. Then I talked about we have an Instagram handle and our YouTube channel. You could also go on YouTube and just search Ask the Pediatricians. You see the channel, and then you watch our past videos. Some of you were asking questions about the child's nutrition and all of those. We've answered immunization, so many topics. We've been on this for more than 6 months, so just enjoy yourself. Thank you very much for joining in. Till we see you again next week. It's bye for now.
Bye. Thank you so much for joining us, and thank you. And on behalf of Ask the Pediatrician Foundation, we wish you compliments of the season. And if you want to support us, please get in touch. There are many ways to support Ask Pediatricians, and beyond what we do online, we also do a lot of things offline, and we will appreciate your support. Okay, thank you, everyone. Bye. Have a wonderful weekend.